Hi, I'm Leslie Elliott Boyce, and today I'm speaking with Andrew Hartz of the Open Therapy Institute. And Andrew, you and I have spoken once before in a recorded conversation for this channel, the Radical Center. And it was a great overview of who you are and your circumstances, how you came to be in the position that you're in. And so I encourage people to go back and listen to that if they're interested in more background information. But for now, would you mind giving just a brief introduction for yourself and the Open Therapy Institute?
Sure. So my name is Andrew Hartz. I'm a clinical psychologist. I'm the founder and president of the Open Therapy Institute. The Institute focuses on issues in mental health that are overlooked as a result of political bias. So patient populations that don't have services, don't have an academic literature, perspectives on things in the field, biases in the field. We're trying to address all the issues that aren't being addressed in mental health because of political bias.
Thank you. Yes, and we've been talking about some of these issues, and it seemed like there is a lot of depth to cover with respect to overlooked issues in mental health and the impact of political bias on the field. So we envision this being a several part discussion series where we can kind of get into greater depth with regard to some of these issues. So could you outline that a little bit for us and give people an idea of what to expect?
Sure. So I think there's lots of different ways to think about how bias manifests in the field. There's kind of the overt issues that I think we probably talked about a little bit last time of activist therapists imposing ideology on patients. How does that impact patient care? How does that impact training? How does that impact research? But there's also like subtler biases that even well-intentioned therapists make where they don't understand certain patient populations like conservatives or people with religious views or people with experiences that they don't have any training on. And they might be uncomfortable with certain topics. They might avoid certain topics. They might inadvertently impose a value system on patients that isn't their own. Or express discomfort with something. One example of that might be like a patient who's a gun owner and the therapist just stigmatizes guns, is really uncomfortable with it, and it's not very patient-centered. It can lead to a clash and bad care, which you don't want. But there's lots of other examples of that. And there's also deeper levels of bias that come into therapy that I think have kind of sunk into the bones of the mental health system. For example, idealizing victimhood, maybe coaching consciously or unconsciously coaching patients to see themselves as victims, blaming parents, setting unrealistically high expectations for parents that make parents miserable, and or not acknowledging differences between men and women, assuming that everything related to gender is socially constructed, favoring certain types of emotionality, like maybe tearfulness is prioritized and things like humor or more behavioral responses to things are maybe undermined. So there's all different ways that there's biases that can come into the therapy room. But there's other ways that biases impact mental health care that might be harder that people don't initially think about, like patient populations that there's no literature on. And I just wrote an article about victims of anti-white aggression. There's a lot of people who have that experience, everything from violent attacks to harassment in the workplace to false accusations of racism, bullying in schools, lots of different ways that people experience that issue. And there's basically no literature in the field on it. Nobody gets training on it. And there's no clinics in the country that focus on that issue or specialize in that issue. So there's other issues too around masculinity, around the experience of being canceled, around how self-censorship impacts people, lots of different issues where the field is just really biased, either in terms of the research, the academic literature, the training, the services. And then there's another layer too, which is perspectives on the world that are missing.
Mm.
You know, the mental health professors and practitioners skew very hard to the left, and it means that a lot of perspectives don't get mentioned. One example of this is most recently, like would be like masking during COVID, where, there's reasons to think that not being able to see other people's faces and they're not being able to see your face would impact something like mental health. You need to see faces to communicate with people, to connect, to regulate, and it has an impact on mental health. And the field was mostly silent on that issue.
Mhm.
And I think that if the political parties had been flipped and it was Republicans who wanted to make people wear masks and Democrats who didn't, I think there would have been thousands of papers on why you need to see people's faces for autonomy and dignity and freedom and mental health and all the other things.
Mhm.
So other issues and perspectives on DEI and how that might negatively impact mental health, perspectives on gender and sexuality, perspectives on everything that's happening culturally. So there's just a long and short of it is there's a ton that's not being mentioned in the field
Mhm.
and that's not being addressed.
Do you picture going forward a greater education around a lot of these missed issues, these overlooked issues, or do you picture more of a plurality of therapy options? Because it's hard to imagine that someone could be a therapist for everyone. What kind of way
Yeah,
forward do you see?
that is a really interesting question. I think there's the old school way is about the neutral therapist
Mhm.
who doesn't have bias and can see the far left activists and the far right people equally,
Mhm.
and they don't have any bias. I'm I'm not sure how realistic that standard is.
Mhm.
People have strong feelings, people have values. I don't think it's as easy to set that aside and be neutral.
Mhm.
Another way of framing it would be about clinical skill. Who do you have clinical skill to work with? And if you have particular knowledge or empathy for a group, that might be a group you're skilled with. If you don't have knowledge or empathy for a different group, maybe that's a group you shouldn't work with. Um, and I think this is an open debate. Even at the Open Therapy Institute, there's a range of perspectives on it. Um, my guess is there are some really skilled people and some really talented people who can see a shockingly wide range of people and do well.
Mhm.
But I think that's pretty rare. I think for the rest of us, you kind of have a range of what you can do and what you have knowledge in, and that's probably a limitation for the large majority of therapists.
Mhm. Mhm. Yeah, I've said before that I think that social justice therapy training would perhaps be acceptable if there were a social justice designation for working therapists so that the client could know what they were actually receiving when they go in to see one of these trained therapists. And
It's it's
yeah.
it's essential, and I think that's an ethical issue. This is part of informed consent.
Mm.
If you go to a couples therapist and it turns out they are working from a feminist orientation, they have to disclose that as an ethical issue,
Mm.
and they often don't. So you go thinking you're seeing a regular couples therapist,
Mhm.
and they're having this ideology that they're bringing into it, and you don't even necessarily realize that this isn't what all couples therapists would do.
Mhm.
It's a specific ideology, and the same goes for any social justice orientation. They should have to disclose that, but they often don't. But
Mhm.
I cut you off.
No, no, that's okay. How do you think we got in the position that we're in right now, where there are so many overlooked populations? How do you think therapy became so politicized?
I It was some of this stuff has been a pretty slow burn.
Mhm.
Some things have sunk in gradually over the years, and the field just kind of drifted, and I think wasn't even aware.
Mhm.
And there was a kind of like just obliviousness to the way that they were growing increasingly misattuned to people who had different value systems.
Mhm.
Um, in the past decade, I think it's been really overt activists deliberately capturing institutions and pushing out anybody who disagreed. And it was really an organized campaign. And I think related to that, I do love our field, but a lot of people that are attracted to being therapists are a little bit shy. And even when they see stuff that they know is wrong, I mean, it's in every field is getting politicized. Law is politicized, medicine's politicized, education's politicized. Being a writer for a TV show is politicized. It's we're not unique. Um, but I think it might be especially hard for people in our field to actually have the courage to say we're teaching and doing things increasingly that are unethical and counter-therapeutic. Hopefully that's changing, but it's taken a while to get people feeling comfortable to speak up.
I haven't heard that expressed before about shyness, but it really resonates. I really see what you're saying, and I have one of the ideas that I hear about this is that people who are drawn to the helping professions or therapy tend to be very agreeable, and so they're more likely to go along with something. But when you add in shyness to that, it really does make sense that there would be hesitation with speaking out, and that folds neatly in with the experience that I've had of hearing from so many people who are currently in therapy training programs who say that they just want to put their head down, do the work, and when they get done with their training program, hopefully they can practice the way they want with their clients. So I think that there's a lot of need for people in that position to hear the issues raised that you're talking about right now.
Yeah, and there's a lot of obliviousness. One of the biases that I think is a great indicator if you want to see how biased the field is, go on Psychology Today and look for a therapist and see what percentage of them, right after their name, it's their pronouns. It's the first thing on their page.
Mm-hmm.
Now, my experience is most of those people are listing their pronouns because they think it's a nice thing to do.
Mm-hmm.
They're being nice by being inclusive to trans people. And there's no awareness that that sends a signal to anybody who has concerns about the ideology or how it's practiced, that they might be signaling disagreement with them or a difference of values, or how it symbolizes kind of like a general wokeness
Mm-hmm.
where it's like, okay, the therapist that puts their pronouns, they probably support BLM, maybe they support defund the police, they probably hate Trump. There's a whole set of things where that are being communicated, and it's shocking that they don't seem to have any awareness that of how much of the country doesn't share those sets of values and that they're alienating. Um, they think they're being nice, and they're just kind of, I think there's a lot of blind spots.
Mm-hmm. Since you've been participating in these discussions around concern about the political bias in therapy and with your experience with Open Therapy Institute, do you see a lot of pushback in the field? Do you see a lot of people in the field agreeing with your concerns?
I haven't got as much pushback as people would have expected. I mean, I just wrote this article about victims of anti-white hate and now they need how they need care. I think I had a nice but assertive tone. I wasn't trying to attack anybody personally. I would have, to a lot of people, that's a very controversial topic. I don't think it should be a controversial topic,
Mm-hmm.
but I think in our time in 2024, it is sadly. Um, but no. I haven't gotten a single negative communication from anybody about that article.
Mm-hmm.
Every response has been positive. And people might, I think people probably in general, not just in our field, but in all the fields that are getting politicized, they overestimate the risks of speaking out and they underestimate the risks of not speaking out.
Mm-hmm. And
Yeah.
yeah. So they overestimate the risks. So they're intimidated to say what they think because their impression is that everybody is against them on this.
That if they say people who are victims of anti-white hate should get medical care,
Mm-hmm.
they think they'll be the mob is going to come to destroy them. And not yet. I did make a decision when I wrote that article and other articles that I'm kind of like, this is a hill I'm willing to die on.
Mm-hmm.
I think it's atrocious that we are abandoning such a large clinical population that really needs skilled care and can't count on it from the average therapist, I think. I think that's a travesty, and I think it's horribly unethical. And so I'm willing to die on this hill, and I have to make that decision. But the surprising thing is that I don't think I'm gonna have to die for this. I don't think it's gonna take me out. I think, and even people who are woke have a hard time making the argument that victims of anti-white hate shouldn't get mental health care. That's
Mhm,
a tough argument to
mhm,
make.
mhm,
And so even people who are really, really, really woke have a
mhm,
hard time saying that.
mhm,
Um, so no, I haven't got as much pushback. I've been getting more support slowly. People are coming out of the woodwork and wanting to join, and our team is growing, both of therapists and people who want to give talks and workshops and write things. So
mhm.
slow and steady.
And the amount of support that you're seeing from colleagues who do share your concerns, is this cause for optimism? How do you feel about this at this point? How is this growing?
Um, I a lot of it is like we're beset by kind of like institutional and organizational challenges about how are we going to manage staff and get
Mhm,
money and structure things. And I think that's probably one of the bigger bottlenecks right now.
mhm,
Um, and making sure that people who do want to be involved are reaching out.
mhm,
Um, but it's just piece by piece.
mhm,
I think part of it is, and part of why I wanted to do this podcast with you was people might be um, overly fixating on the problem of the most aggressive activists in the field,
mhm,
as that's the problem. There's this group of really, really hateful people. They've kind of taken over a lot of institutions, and that's the central issue. That is an important issue, but it's not the central issue to me.
mhm,
To me, the central issue is people throughout society are dealing with this, and we could be helping. We
mhm,
could be formulating what's happening, providing theories and evidence for how it's impacting people, providing tools that help people respond, addressing the problem in a constructive way. We could
mhm,
be doing all of that. And the field isn't.
mhm,
Most of the time it's actually piling onto the worst stuff. And I think people are trying to maybe hide from it, weather the storm, and hopefully they'll come out afterwards. But really, I think we need to be at the center of actually solving these
mhm,
problems. Um, and it's not just about confronting the activist contingent.
mhm,
The activist contingent, they want to fight.
mhm,
They want to fight to the death. There's tons of aggression. That's what they're attracted to. It doesn't interest me as much. I would much less rather fight with them than think about the people who actually need help and try to actually help the people
mhm,
respond who need it. I'm not going to persuade them.
mhm,
And, but I think people do need to get a sense of like, there's work to be done.
mhm,
There's lots we can do. It's like there is a moment here to like roll up our sleeves and start mapping out all of these issues and really doing this work. There's lots of work to be done. And I think so I think when people hear that message, hopefully people will want to start participating in that.
Well, I think it's a really necessary message, and I'm excited that you are addressing it in this way. I wouldn't have gone back to school to become a counselor if I didn't believe in this field and think that it had a lot of value for people. And yet I've had concerns about it, from over medicalization to over politicization to the incursion of social justice ideology into therapy. And I think that there's so much of this coming to the surface right now that's concerning for so many people, that there's a temptation to sort of throw the baby out with the bathwater and be very critical of therapy as a profession and as a resource. And yet, as you're pointing out, there are amazing tools that mental health research and support has to offer people, that actually can be part of a solution going forward for a lot of individuals who've been harmed by these very things that we're highlighting as concerns, because they're concerns not only within the field of therapy but culture wide right now. There's a lot of this going on, impacting individuals, families, institutions, education in so many ways. And having a solution focused and positive orientation toward how can we actually help people is really refreshing.
Yeah, and I think that's why they're losing. I mean, we're not helping with the central things that are impacting them. It's
Mhm,
not surprising why they would think what we're doing is worthless. And too often the establishment of the field is really focused on supporting some really hateful and destructive stuff that is negatively impacting people. So it's pretty obvious that a lot of people are gonna respond with hostility towards our profession.
Mhm.
And I think they need to actually see issue by issue. Let's unpack this issue. What could you actually do that's helpful? You know, not just a couple tips, but really kind of explaining what's happening in more detail and how people can respond in more detail
Mhm.
to the challenges they're facing. Like as one example, okay, so if you're in a program, or could be a law school program, it could be that you work at a bank. People experience this in all these different places, and and you go to a training that's super hateful, sent signals are sent that dialogue is not acceptable or something. I think there's ways of, a lot of times I think people feel like my choices are keep my head down, go along to get along, quit, or try to take on, stand on a table and try to take on the whole system single-handedly.
Mhm.
And, none of those are likely to lead to any reform of the institution. Sometimes you do have to leave. Sometimes it's not reformable and you have to do something else. You can't make it there.
Mhm.
Um, but another way of approaching it would be, are there allies that you can find?
Mhm.
Are there other people? They don't have to agree with you on everything. Are there other people that are open-minded, or they want viewpoint diversity too, or they agree with you on an issue or two? If you can get a few people, you're in a totally different situation. You have support. You can get your head screwed on straight about what's happening and talk through what you're seeing. And you can think about what would be an effective thing to lobby for if you do want change. It's probably something more mild, like adding a training around viewpoint diversity to
Mhm.
the training,
Mhm.
as opposed to something more confrontational. Um, and I think there's the other piece of, like, this is like another angle on it. If you're somebody, for example, that's prone to anxiety, maybe you have a history with social anxiety, and this is now happening at your workplace, it's reasonable to think that your anxiety is gonna possibly be triggered and latch
Mhm.
onto this context so that you're very anxious now. And so symptoms can reemerge and take shape here. If you're somebody who's more depressive, that's probably more likely to be the response about how hopeless everything seems, and maybe a tendency to kind of feel drained or to want to give up. So all the individual idiosyncratic things that people struggle with are likely to get triggered in this context. And so, you know, the treatment for depression and social anxiety in these contexts, a lot of it probably looks similar, but it is around these issues. So wrestling with that is probably going to be part of the response, so that you don't just fall into the same worst worst pattern that you did in the past.
Mhm. Mhm. That's a really good point, and I think it would be wonderful to see more awareness around these overlooked issues and around the need for viewpoint diversity to grow, especially among people in training programs, so that they don't feel so alone with this, so that they do feel like they can ask questions that are, as you said, there's signals being sent that questions are not tolerated or other viewpoints are not being tolerated. But if you have a sense that other people in the room know these things and maybe have the same attitude that you do towards them, maybe you can start to politely raise some of these questions and push back on what feels like a really strong arming ideology.
Totally. I mean, I made a worksheet for Heterodox Academy that was on this, and
Mhm.
it was basically just dialectical thinking.
Mhm.
Just think about every issue as having pros and cons.
Mhm.
That's how your class starts. And you're going to do that throughout the class. So when DEI ideology comes up, you can look at those claims and you can think about, what are the pros and cons here?
Mhm.
And just shift towards a pros and cons framework for thinking about these. Whereas the DEI training that I did, it was always their ideology was perfectly right about everything. And if you had any questions or concerns about it, you're a white nationalist. There was nothing dialectical about it. Dialectical thinking was not tolerated. So to shift it towards a dialectical framework obviously radically changes a social environment. Um, but there's other tools like that too that can be helpful. And I think they don't just apply in our field, they can apply in any educational context or even a workplace context where, they're doing this at your law firm.
Mhm. Well, I hope we can get into some of that. That sounds extraordinarily helpful.
Okay.
Do you feel like we've got a good overview now that gives people an idea of the content of what we'll want to discuss, or have we left something out?
Well, we've left a ton out, but we can't get to all of it. I think we just want to start outlining how concepts from our field and work in our field can really help with all the cultural issues at the moment, and we'll just kind of take it piece by piece and go from there.
Well, I'm really looking forward to it. Thank you so much, Andrew.
Thanks.